Well, I'm just going to be just around the corner, so I'm sure we'll be chatting offline. But I said I couldn't leave without having a final conversation with my dear Dr. Erica Wheeler.
So much. I feel the same, Lisa.
Yes, absolutely. So Carrie and Rocus, they're here as well, and they're going to weigh in. But the COVID-19 vaccination has started to be rolled out here in Trinidad and Tobago, as it is being rolled out around the world. And even before that, we saw the TikToks being made and so many memes being done with people, having their hesitations, their fears as to what, why they're not going to be taking it or what could be happening and all the conspiracy theories. Could you talk to us about what's being done to, uh, you know, put at rest some of those fears?
Well, I'm happy to say that the ministry has taken very seriously the need to have a communication strategy. And the ministry, together with PAHO, we're working very closely at producing a video. We are going to be putting out messages on social media. Of course, the ministry has its own portfolio of work, own
Mm-hmm.
strategy. So do we, but we've also agreed to come together on certain areas because the emphasis must be on vaccine acceptance. We don't want to talk about hesitancy. We know that there will always be a certain percentage of the population who may be hesitant, but it is really important for us to bring out the positive messages about the benefits of the AstraZeneca vaccine. So we will have, there is a communication strategy in place, both by PAHO as well as the government, and there are certain areas we will be working with them on. There will be billboards, there will be radio programs, there will be TV programs, interviews, posters, social media posts, because it is really important to emphasize something, which is if you hesitate, you give yourself the opportunity and you open yourself up to actually having the risk of getting COVID-19.
Mm-hmm.
So rather than sit on the fence and wonder, why not just do it?
Mm-hmm.
We see in many countries of the world nurses and doctors coming forward and showing that the vaccine is safe.
Yeah.
We had these reports of people dying from the vaccine. You hear occasional things, but don't think about them as factual because it takes time to even determine if someone dies within a particular period of time after receiving a vaccine. It may have absolutely nothing to do with the vaccine. So
Mm-hmm.
there's no proof so far that there's mortality. And
Mm-hmm.
so each human being is different. We can't say, 100% nobody may suffer.
Yeah.
But on average, we can see from the results of the vaccines that it is far more beneficial to have manufacturers to go their own way and develop their vaccines and compete with each other on the basis of, who can sell more vaccines than another, although that has inevitably happened. the COVAX facility has pre-financed the production of the vaccines. This has never been done before. So, of course, the results of that is that the manufacturers had the funding to do the research and development upfront rather than depend on their own funding. So this really accelerated the development of the vaccines. Plus, we have new technologies. I mean, we're living in the 21st century. The Moderna and Pfizer vaccine were developed with new technologies. That does not mean that there's anything wrong with them because human beings, science progresses. So the fact that the vaccines were produced so quickly is due actually to the pre-financing of the work of research and development. That is the main reason. It has nothing to do with whether it's safe or not. So it's very rational reason.
Yeah. Now, historically, because PAHO would have been involved in the rollout of, vaccinations around the world over the years, historically, have you seen, an aversion to vaccinations? You must have. And what has been the uptake historically? Is it similar to what you're seeing now?
So, absolutely, historically, there's always a percentage of people who fear taking vaccines. There is, and there always will be a minority of people who have severe allergic reactions because no human being is a rubber stamp of the other. So our immune system is different. So there will be a small percentage of people who cannot take vaccines, and those people are protected when we reach herd immunity. But in general and historically, in every country, everywhere, there's a small minority of people. I mean, it's grown, I think, in some countries in recent times because of the internet and social media. There are negative messages being put out there that say, don't take vaccines because of X or Y. So we are not surprised or shocked that there are people who don't want to take vaccines. As I said, some of them for very good reasons, but some of it is due to the misinformation and the myths about vaccines. When you have to go to school, before you go to school, there are certain vaccines you must take. People have done that for decades. They've been taking measles, mumps, and rubella vaccines. When you want to travel to a country where there may be yellow fever, you want to travel, so you take your yellow fever vaccine. You don't stop to think, well, should I or shouldn't I? Because you won't even be allowed to come to some countries without your yellow fever vaccine. So vaccines have been a part of our lives. So has been the thought in some areas that, vaccines may harm you. But this is where a well-organized communication campaign with factual information about the myths and the truths about vaccines comes into play. And the more we tell the general public about it, the better. So we know even some health professionals may be hesitant, again, going back to your reason that the vaccine was developed quickly. But again, we need to say why the vaccines were developed so quickly. And we have something like 63 more candidate vaccines in clinical trials that have been developed more traditionally as well in the industry.
Dr. Wheeler, if I could just jump in for a second here. Sure. I just want us to be clear on exactly what the vaccine is going to do. Is it meant to stop or prevent the spread of the virus, or is it meant to stop and prevent you from getting the virus? And also, can you explain exactly how does the herd immunity aspect of it work? How do we achieve herd immunity?
Okay, so the vaccine, this first acute phase of the pandemic, the vaccine is meant to end that phase. What we mean, therefore, is to stop persons from getting the disease, from becoming ill, and from dying from the disease. What the evidence so far, we don't have sufficient evidence that says if you have the virus in your mucosa, in your, upper respiratory system, for example, your nose, that it is, we believe from the evidence, because we don't have anything to the contrary as yet, that it is still possible to transmit it. But if you are vaccinated, the chances are that you will not get the disease and die from it. Because remember, different vaccines have different levels of effectiveness or efficacy, as we call it. But anything over 50% is worth getting. And herd immunity, you reach herd immunity when at least 70% of your population has been vaccinated. So it means even if I have it and I transmit it, the chances of you getting it would be far, far, far less when you reach herd immunity. So that's the difference. You get the vaccine, it prevents you from getting the disease and dying. It does not necessarily stop you from transmitting it if you have it in your mucosa, in your nose, and you sneeze and you cough and someone else is near to you. That's why at this stage it is still important, even while vaccination has started, that people wear their mask and keep on doing their social distancing. But the fact is, if enough people get vaccinated, then it radically reduces the likelihood that the disease will spread widely in the population. That's why we advocate vaccination in general, that protective effect.
Okay, thank you very much.
Dr. Wheeler, good morning. I have a question here myself. There are a couple articles that stated that the AstraZeneca Oxford vaccine is 63.09% effective, as you were speaking earlier on the efficacy of the vaccine. Say, for instance, I were to get that vaccine and it was not effective. What then?
Okay, so I will start by saying there is no vaccine that is 100% effective. And yes, some vaccines are efficacious, whichever, effective in the community in terms of protecting people. So there will always be a chance that someone who has the vaccine may develop the disease, right? But the standard, as long as it's at least 50% effective, you won't, you're still protected. Now, the question you asked about what next if you do get the vaccine, all countries have mechanisms to follow up persons who have what we call adverse effects against the vaccine, and there is always covered by the national government to ensure that persons get compensated. So two things happen when countries, at this stage, when the country decides, yes, we agree to get the vaccine, the government needs to sign what's called indemnification and liability for the vaccine manufacturer at this point, because it's under emergency use listing, which says the government will take responsibility. But Trinidad and Tobago already has a compensation mechanism because remember, Trinidad and Tobago, like countries around the world, have been vaccinating children and adolescents for HPV and adults for H1N1 for a long time. Right. So there is already a mechanism in place should you develop adverse effects that have been proven to be as a result of vaccination. So it's not that, you're just left on your own and nobody takes care of you. No, that's not the situation.
Right. Thank you very much.
Dr. Wheeler, I want to thank you so much. We're out of time, but I want to thank you so much for coming in today to help us allay some of the fears of persons by providing exactly what you said, information that could help us understand a little bit more about what the process is like. And as you continue with the rollout campaign, I'm sure persons will get the information that they need to make the decision with regard to whether they take the vaccine or not. And thank you for providing the service that you do, especially by giving us your time here on the Now Morning Show. And for me, it's not goodbye, it's until we talk again offline, okay?
I hope so, Lisa. I really sincerely hope so. Thank you so much for always inviting me and allowing me to share what we know with the public. Thank you again and all the best.
Thank you. All right, we're going to take in a few messages, and when we come back, we continue here on the Now Morning Show after this. Back up.